Welcome to the 2020 St. Elizabeth Volunteer Annual Training. This version of annual training is for Level 4 volunteer positions. The level of your position is listed on both the requirement sheet and the annual training answer sheet that was mailed to you in early June. If you do not have those and are uncertain, please call your volunteer office to determine if this is the right annual training version. So, changes. COVID pandemic has certainly changed many things, including this year's annual training presentations. We could have no group presentations this year. But additionally, it's made us more aware of the absolute importance of standard precautions. We all have some new fashion accessories with the wearing of masks and increased respect for personal space, the social distancing. But there's one thing that has not changed. You are needed at St. Elizabeth. And in case you were wondering, we love our volunteers. And that certainly includes, starting at the top left, Jan Schipper, who is the Edgewood go-to person. That's me, Janelle DeLumba, the Director of Volunteer Services in Primewise, there in the middle. Erin Pittman, who is our Volunteer Services Manager. Then on the bottom left is Debbie Holleran. She is our Hospice Volunteer Coordinator. Margie Kiekler is the Fort Thomas and Covington Volunteer Coordinator. And then Vicki Miller is our Florence and Grant Volunteer Coordinator. So before we get started, since most of you will be reviewing this from the comfort of your own home, please do that. Get comfortable. You can pause this at any time, whether you need to go get a drink or whatever you might do. So feel free to do that. Once you've completed this and you have turned in your answer sheet, and we've got that, we will record training time for you, so that will go into your volunteer record. If you've ever completed volunteer training before, you know that this truly is a review. There's really nothing new in here. It should just be a good refresher. So we appreciate that. It's just kind of our annual update. So June is traditionally our mandatory TB testing time for volunteers, but in keeping with our social distancing precautions, TB testing is being postponed until a later date. Additionally, beginning this year, only volunteers in high patient contact positions will be required to complete an annual TB test. This is due to some new state regulations, and this applies both to associates and volunteers. So information on completing this requirement will be sent in a future communication, so look for that. June is often as well when we will send out a survey of our current volunteers, adult volunteers, about their experiences at St. Elizabeth Healthcare. And again, we have made the decision to delay that or postpone it until all phases of volunteers have re-engaged, and that's been completed. So we'll let you know when that will be later, and we'll look forward to hearing your response and once again documenting how St. Elizabeth is a great place to volunteer. So we want to thank you if you've already completed your self-review and for going ahead and turning that in. It is required, so we do need you to do that if you haven't. So, and we do review each one of those individually. You can expect follow-up within 2 months if you have requested it on that form. And we also greatly appreciate you updating your contact information. We know that cell phone numbers change. We know email addresses change. We know emergency contacts change. Please help us by updating that. We appreciate that. We got one save the date in here, Volunteer Christmas Week, which will be the 7th through the 11th of December. You'll want to make your way to a volunteer office to make sure you get your box of Esther Price. From Garen Colvin, our CEO, and we'll also have a gift and some goodies for you. So we'll look. So make sure you get that on your calendar. We're also doing our $10 off uniform. I don't want to call it a sale, but offer, which is good through August the 14th. We have lots of styles to choose from. There's just a few of them there on your screen. So please stop by any volunteer office to see samples and to get an order form. If you're looking to replace or add a short sleeve polo shirt, The cost to you is $10. So with the $10 off, you can get one of those at no out-of-pocket cost, or again, $10 off any of the other choices. So we are always looking for new volunteers at St. Elizabeth, always welcoming them. And you are our best referral source. You who enjoy volunteering, and you are always the best way to recruit. So we do ask you to spread the word. Particularly, we've got a new cancer center coming on. We're going to be looking for lots of new volunteers. If you refer somebody, once they begin to volunteer, you'll get a $25 gift certificate, and it can be used at any one of the gift shops. So we also have some information pads in our offices if you want to use that as a way to help spread the word. But certainly feel free to talk about us and talk about volunteering in your groups, or on your Zoom game nights, or on your Facebook pages. And a big shout out to our scholarship awardees this year. Usually we present them at our annual award, or it's not our award, our appreciation dinner. And unfortunately this year we were unable to hold that. But thanks to the St. Elizabeth Florence Auxiliary, the Fort Thomas Auxiliary, and the Second Time Around Thrift Shop, we were able to award 10 $1,000 college scholarships to our graduating teen volunteers. Now, we had a lot more than 10 who were eligible and a lot more than 10 that applied. So it was a difficult decision, but all of those who applied had to have been volunteering and to have accumulated over 100 hours of service as of December 31st of their senior year, and to be actively volunteering at the time. And I'm pleased to share with you the 10 names of our 2020 scholarship recipients. Ashley Avery, Mallory Gray, Madison Griffith, Ashlyn Talbert, Sophia Forlenza, Evan Grimes, Seth McCoy, Kelly Oberst, Fujin Brau, Anastasia Polgers. Big congratulations to each one of them as they move forward. So you might have heard me introduce myself as the Director of Volunteer Services and PrimeWise. So if you are 50 years of age or older and are not a PrimeWise member, well, you need to do that right now. It's free, and you can do it online or call the office, and there's lots of benefits. We have a discount directory with discounts with chiropractors and attorneys and fitness places. We provide for those who are eligible or Medicare beneficiaries or beginning to retire, or who caregive for somebody. We do a lot of assistance with Medicare and health insurance. We have a newsletter that comes out 3 times a year with chock full of programs and screenings and travel opportunities. We provide a caregiver support group if you're a caregiver, free notary. And I've been doing this for 32 years. Monica Braunwart, who is our coordinator, she's been there for 12 years. Ashley Bedford, we're here to be a great resource for you. So please join. As you're probably well aware, the St. Elizabeth Foundation is a nonprofit organization because St. Elizabeth does not generate sufficient funds from our revenue to handle all of the purchases and all of our initiatives. And so those are supported by our generous donors to the foundation. And some of those things that they have supported have included the Hospice Center, our Heart and Vascular Institute. We work with pack and play and car seats for mothers who do not have those items. The Hospice Stars grief support for kids, mammography van, and the Da Vinci robots, just to name a few. And the big one right now is the Cancer Center. You heard me mention that when I was talking about volunteers. We're so excited to be providing a state-of-the-art, world-class cancer center on the Edgewood campus. And if you have driven by there, it's amazing. So hopefully at some point we'll be able to give tours. Also, we invite you to join the Second Time Around Thrift Shop, the Fort Thomas Florence Auxiliaries. They do great things besides supporting our scholarships. The Second Time Around Thrift Shop is located in Covington on Eastern Avenue to 20th Street. Always looking for independent community members who love a bargain to volunteer or to come and shop or to donate. And you can do as little as one 5-hour shift a month, and all the proceeds benefit St. Elizabeth through the foundation. Same with Fort Thomas and Florence Auxiliaries. They hold quarterly luncheons with speakers, although those have been suspended right now. Sponsor annual baby shower for the family birthplace in the NICU, which is do lots of fun events and connect. It's really a good time to connect with a bunch of wonderful women. It's $15 a year or $150 for a lifetime commitment. Please consider these. So as a dedicated volunteer, you are your gift of time and your service make you an inspired giver. The foundation greatly honors and appreciates your generosity. So in addition, I want to make you aware that you might be interested in one-time gifts, a benefactor club, the Samaritan Society, and the Heritage Circle. So again, thank you for being an inspired giver. So here is something that each and every one of you should know. You are the patient experience. You make a difference with everybody you interact with. Thank you. One of the ways you're the patient experience is by using AIDED. It's not a great acronym, it doesn't roll off your tongue, but it is our tool for complete communication. As you already know, it's pretty makes some common sense, but sometimes we get in a hurry or we shortcut. And a reminder about this is really helpful because, we really want to acknowledge everybody. We use that 10-5 rule. Somebody's within 10 feet of us, we make eye contact. Within 5 feet, we try to make some voice contact. How are you? May I help you? Whatever it might be the right thing. Because we don't want to be that person who's behind a desk. Somebody comes up to us and we're talking or distracted and we don't even know that they're there. We want to acknowledge people. And then we want to introduce ourselves and or our service. If I'm a volunteer on a unit or with patients, I want to say, hi, I'm Janellen. I'm your volunteer here today. I'm here to check on you or whatever I'm there to do and share what I'm there to do. But if I'm a volunteer in the gift shop, I'm not going to say, hi, I'm Janellen DeLumba. I'm the gift shop volunteer here today. How may I help you? I'm going to go right into, hi, is there any way that I can assist you or are you ready to check out? How may I be of assistance to you? So you would be introducing your service. Duration and destination. Always really helpful to provide a time frame or some type of framework with directions. I always like to use the example of, giving directions, say, to an elevator. I could say, go down the short hall, turn right, and about halfway down the hall on your left is the elevator. Or I could say, go down the short hall, turn right, the elevator's down there. Now, if I do the second, say it's just down there, I'm going to start looking for the elevator pretty quickly. When it's made halfway down that hall, and then I might get worried I've missed it and start asking somebody. So again, just kind of providing those kinds of frameworks or time frames. Or if you're in a room or somebody's asked you, I'd like some water. I'll be back in, I'll go get that and I'll be back within 5 minutes. Is always helpful. And explanations, because that just rolls into explanations. Now, you and I, we can't give any explanations about test results or what their x-ray said, but we very much can provide as much information as we can do. So, again, if we're directing somebody someplace, and when you get there, make sure you sign in at the desk, and they'll take really good care of you. Anything along those lines that we can provide is helpful. And finally, thank you. Lots of times we find that somebody will thank us, that you've provided them with a room number, or you've done something. They say, thank you. Well, it was my pleasure to serve you today, or thank you very much. Or if you're leaving a room, you can say, thank you very much for letting me visit with you. I appreciate our conversation. Whatever is appropriate, but what it does is it completes the conversation. It brings it to a pleasant conclusion. So important. Not only does this make sense and it feels like the right thing to do, but there's all kinds of research that says it is. It impacts our patients and our guests. By acknowledging them, we increase their sense of security. Oh, good, they know I'm here. When we introduce ourselves, it decreases their anxiety. They know how we can help them. When we give that kind of duration or those time frames, we increase the chance that they'll successfully get where they're going or that they'll have a successful encounter. Anytime we explain, we increase that quality. We all like more information. And then when we thank them, we increase the satisfaction when we bring that to a conclusion. Those are the reasons we do that. Besides, it's just good. And then our best practice is always to escort guests to their destination. Every guest, anybody who asks you for directions when you expect anybody who's wearing a St. Elizabeth badge, associate, volunteer, to know, be able to tell them where they're going. But you will exceed their expectations if you take them there. They don't expect that. And sometimes that's not possible, and maybe you can't even escort them all the way, but escorting them part of the way hugely, makes a big difference. And if you can't do it, then provide clear directions. Again, remembering some of what I just shared. But people can really only remember about 3 steps. So try to keep it to 3 steps or less. And, I have found pointing, I'm a very demonstrative person. If I'm directing, saying, and you'll go down there and turn to your right, well, my hands are going to be up and my arm's going to be pointing to the right. But I don't want to be pointing to the right because sometimes a finger point can be misinterpreted as I'm telling you what to do in a negative context. I try to have an open palm. I'm pointing to the right. That just feels good. Try it. You'll be surprised. So wearing your badge on your upper body at all times when you're volunteering is essential. It's even more important during COVID times because you're going to need that to come in so that the individual who's out the door taking temps doesn't think you're a visitor or a patient. Because, again, that ID badge will identify you as a member of our team. If for any reason you cease volunteering, we do need you to return the volunteer badge to the office. So we have a professional environment here at St. Elizabeth, and our dress code for volunteers and associates reflects that expectation. Volunteers are required to wear their uniform at all times while volunteering. Makes you easy to identify. It gives you a professional appearance. There are a couple of specific exceptions, and those of you know who you are. So we do ask, according to our dress code, that you wear slacks or pants. Of course, you can wear a skirt as well of appropriate length. But a solid colored dress or casual style, please. No ankle length. We want them to be ankle length. No shorts or no mid-calf capris. And please, they cannot be made of denim or nylon or be yoga pants or anything that's we really want them to be dress or casual pants. And then the shirt or top, if it's not your uniform shirt, then a dress or casual shirt or top. No t-shirts, please. No hoodies, no sweatshirts. And no sleeveless tops with vests. And then no shirts with writing or logos except for St. Elizabeth logos. So we all know we have our cell phone. We all need our cell phones, and we know that. But while you're volunteering, we ask that they please be on vibrate or silent because they'll go off when we're serving a customer or with a patient, and that our volunteer role here comes first. But if you do need to take a call or do a text, that's fine. Just please excuse yourself and move out of earshot or out of eyesight, please. Never, ever text in a patient room or in front of a guest. They can definitely misinterpret that and think that you are communicating about them. And they're not to be used to check websites or play games while you're here at St. Elizabeth. If you have a laptop or a tablet, they are not to be used while volunteering unless specifically permitted by your volunteer supervisor. So we do need you to report any injury that you have while you're at St. Elizabeth to your supervisor because we do need to have an incident report completed. And that needs to be, volunteer services needs to be informed as well. So depending on the severity of the injury, we'll ask you to see your doctor or go to the emergency department. And volunteers, you are covered under the St. Elizabeth liability insurance coverage. So we will cover the costs, any related costs for any injury that occurs while volunteering, regardless of the fault. But we do need to have the incident report completed in order for that to take place. So your health, you do need to notify the volunteer office if you are hospitalized, off for a medical reason, have any COVID-19 symptoms or around someone COVID positive, have a a temperature of 100 degrees or greater, or under medical care for an illness or condition that impacts health or safety. You need to stay home and you need to let us know, even if it's for a short time, because we will also require you to have a physician. For some of them, we'll require you to have a physician complete a return to volunteer form. Any volunteer office can provide you with a form, and they really do not have a problem completing them. Don't worry about that. Couple of reminders. We need you to act within the boundaries of your volunteer position description, accepting the direction of the supervisor where you volunteer, and then talk with volunteer services if you have any concerns about your position, your supervisor, or any other issues. We all end up having some concerns or questions or, really, is that right? Sometime. And that's fine. Just we ask that you communicate with us about that. We really don't want to hear about that because you shared that with another volunteer or on your Facebook page. Please just come and talk to us. And then, as you're doing right now, completing all required training and health testing and immunizations annually. So keeping it confidential is also a really essential piece of volunteering. We're required to treat everything and everyone we see while at St. Elizabeth is confidential. Sort of like Vegas, what you see here stays here. Patients aren't just those in patient rooms, and our HIPAA rules, Health Insurance Portability and Accountability Act rules apply in all situations. Even if you don't volunteer in a hospital, if you're associated with anything that's associated with your volunteering with St. Elizabeth is confidential. Volunteers may be dismissed for serious or intentional breach of confidentiality, misappropriation of funds, failure to comply with hospital policies such as abuse of alcohol or drugs, violating the no smoking policy, discriminatory or inappropriate conduct, falsification of information given to the volunteer office. Doesn't happen very often, so that's what we're glad for. And thank you. You really enhance St. Elizabeth. So let's get into our required review. So I want to start again saying thank you. Particularly now, I thank you for continuing to choose to volunteer in healthcare. I'm always so overwhelmed and honored and humbled to see just how passionate our volunteers are about their role in making a positive difference in the patient experience. We have more laws and rules and regulations than probably any other place that you could volunteer. And more than ever, you're to be applauded for accepting this challenge. So the Joint Commission, or TJC, is the organization that accredits healthcare in St. Elizabeth and most healthcare organizations. And it is their regulations, their standards that hold volunteers to the same standards as paid staff. And so I like to say they're the reason we're doing this annual training. So the Joint Commission did survey all of our facilities in 2018, and all were awarded their accreditation by the Joint Commission. So they do survey about every 3 years, and we have a survey window because they come unannounced, and it has already started, and it will last until about October of 2021. So let's talk about reporting concerns. We have a corporate compliance program which requires us to know what's expected of us. We should all be aware of and obey the laws, and regulations. That's why we're doing this. This is reviewing and refreshing laws and regulations. And then you want to ask questions whenever you're unsure of what the right action or decision might be. And then speak up whenever you discover something and it doesn't seem quite right. Then it might not be. And also support others' efforts to do the same. And you should report anything that seems unethical, including violation of patient, organization, or associate confidentiality, any of those HIPAA breaches, any kind of discrimination or harassment, dishonest communications, including lying or in obtaining goods and services under false pretenses, theft or misuse of our organization's supplies, equipment, money, or labor for personal use. How do you report them? Well, there's a 3-step process. So you can contact the supervisor in the area where you volunteer. If the supervisor is unable to solve the problem, you certainly can contact their supervisor or our volunteer services staff. If you'd rather not report the issue to a supervisor or the Volunteer Services Office, you can go right to Lisa Fry, who is our Corporate Compliance Officer. Her phone number is located in the phone directory, or you certainly can ask us in the office, or you can ask the operator. But you might want to report the situation anonymously without revealing your identity. And for those, you can use the toll-free 24-hour hotline, and that number is listed here as well as in the phone directory. We have operators from an outside company that will make a complete report of your issue. They'll send it to Lisa Fry, the compliance officer. She will do the investigation. But they can give you, if you don't want to leave your name, a unique identifier, and you can call back later to see how it was resolved. They do not use caller ID, and they do not try to trace the calls. We do have our no retaliation policy, which forbids retaliation against anyone who would report a concern in good faith. And so making a report in good faith will not put your volunteer position at risk. You should not feel threatened about that. We will protect you as long as you're making that in good faith. And anyone who retaliates in any way is subject to immediate discipline up to and including termination. We would also ask if you feel like there's any kind of retaliation that we report that immediately to us or Lisa Fry. So here's your health refresher. Wash your hands, and then wash your hands again, because that is the simplest way to prevent the spread of infection and is one of the most proactive practices one can use, period, protective. Hand hygiene should be performed no matter what your volunteer position several times during your shift. So always use soap and water after using the restroom, before eating, and when hands are visibly dirty or contaminated with body substances or food. When you wash with soap and water, you want to wet your hands, put on the soap, and then here's the key. You want to rub vigorously your hands together for at least 10 to 15 seconds. So sing row, row, row your boat, or the alphabet, or happy birthday. But make sure that you're going in between your fingers, you're getting your back and all sides of your hand up to your wrist. And then rinse them. Get your disposable towel to dry them, and use the towel then to turn off the faucet and open the door before you dispose of it. But you can also use the waterless alcohol antiseptics whenever your hands are not soiled. You apply that foam or gel to your palm and cover again all those same surfaces in between your fingers, both sides of your hands up to your wrists. And you want to rub them until they're dry. It's the drying that makes them effective. You should not use the alcohol antiseptics on hands that are soiled with organic materials such as grease, blood, body fluids, food residue, because then it's not effective. And this should be available throughout all of your assignments. And if you need anything, please let us know. And cough etiquette. This is even more important as we're going. Flu and COVID. These are all respiratory infections that are spread this way. So please, please, please cough into your elbow or your sleeve. It is the best practice. It's the preferred. It really is the way we should all. What practice we should all use. So cough or sneeze into your elbow or your sleeve, because then you have prevented it from going into the air. We tend to cough or sneeze into a tissue. So if you decide you want to do that, just make sure that you turn your head away from others. You try to contain it all in your tissue, then throw the tissue away in the trash. Then use hand sanitizer afterwards. However, if it has gotten onto your hands, then please wash your hands with soap and water. So we want you to be aware of the signs of stroke. You need to remember, be fast. So you want to watch for sudden loss of balance, watch for sudden vision loss, look for an uneven smile, check if one arm is weak, listen for slurred speech. Then it's time to call 911 at the first sign of any of these. St. Elizabeth, Edgewood, Florence, and Fort Thomas are all certified by the Joint Commission as primary stroke centers, and both Covington and Grant are certified acute stroke ready. So we are prepared to provide the highest level of care for our stroke patients. If you see the warning signs of a stroke at somebody at St. Elizabeth, you want to call 22222. Otherwise, you want to make sure you call 911. Don't drive, don't delay, call 911 right away. Symptoms of a heart attack. We all know the classic one, where the elephant's sitting on your chest, so that chest pressure, squeezing fullness, but it can also be pain that travels down one or both arms, sudden heavy sweating, nausea, upper back pain, shortness of breath, jaw pain. All of these kinds with sudden dizziness or lightheadedness, unusual and unexplained fatigue. All are a few of these, one or a few can be symptoms. Not everybody experiences them, but be aware of them. And then with women, the symptoms can be more subtle than men's and may include some of the more less common ones. So maybe more nausea or vomiting or jaw, upper arm or upper back pain, chest discomfort, shortness of breath, sudden dizziness, unexplained or extreme fatigue. And again, we want to take notice right away, because if we notice one or more of the warning signs of a heart attack, the sooner we take action, the less likely it is to have permanent damage to our heart. So if you're inside St. Elizabeth, call 22222, offsite, call 911. We are all a link. Don't wait, and don't try to put somebody in your car and drive them in. Call 911 because they can start treatment on the way. St. Elizabeth is certified chest pain center through the Society of Cardiovascular Care. Safe environment. So workplace violence is defined as any situation that may threaten the safety of a volunteer, have an impact on any volunteer or associate's physical, emotional, or psychological well-being, or cause damage to hospital property. So you want to be aware of and recognize the risk factors and potential triggers or warning signs that are critical to your health and safety. So if anybody, regardless if it's a guest, it's a patient, it's a fellow volunteer, it's an associate, watch for these cues that they may be that they might escalate. Arms held tight across your chest and they're not cold. Clenched fist, heavy breathing, pacing or agitation, a fixed stare, aggressive, threatening posture, sudden changes in behavior. Then there's the verbal cues, speaking loudly or yelling, using very inappropriate language, swearing, threatening tone of voice. All of those things are signs. We really want to use de-escalation techniques if at all possible, and empathy is one of those, which was where we identify the feelings and thoughts and attitudes of another. So, we really want to be respectful, remain calm and respectful, and then listen to the person's frustration. Be caring, kind, patient, be interested, be honest, be attentive, non-judgment. Try to figure out what it is what do they want that they're not getting? How would you feel in that situation? Can you address their concern in any of those? So being empathetic, if this applies, is one of the de-escalation techniques. So as we've already talked about, you want to be on guard for behaviors that could indicate the potential for violent behavior. You want to communicate calmly, clearly, and respectfully. Use some of those de-escalation techniques if you can, all of those. And then you want to keep some distance. It says 1.5 to 3 feet, but these days we're asking to keep 6 feet. And somebody who's trying to escalate is likely to be violating that even closer. So try to keep some space. If you feel immediately threatened, you want to call 911 as soon as you can safely do so. Report to somebody. Make sure that you get into a safe place. And then we always report any acts of violence, workplace violence, to volunteer services, and certainly the supervisor where you volunteer. Another possibility is an active shooter, and we know we can see that in the community as well as when we're volunteering. And the key factors here are to, again, remain calm and evaluate the situation. Can I run? If I can't run, can I hide? If I can't hide and they're right in front of me, I have to fight. So if you can run, leave the area, leave your building, do so safely, and then get to a safe space. And then if you can, call 911 right away. If you can't run, hide. Get in a room, barricade yourself, lock the door, place anything you can, shove in front of the door, turn off the lights, silence your cell phones. You don't want somebody to know you're in there because your cell phone goes off, your pager. Lay low and stay there until the police come and say you can come out. But if they're right in front of you, as your last resort and to save your life, you need to fight. And you do so as aggressively as you can. Use anything that's available to you as a weapon. Use your water bottle. Use a fire extinguisher. Use a letter opener. Use an umbrella. Do anything you can. And then always call 911. The security offices at St. Elizabeth, if you're calling from offsite, it's 301-2270 internally, 12270. And so report anything if you've had some vandalism, some theft, disturbances, anything. And please always keep your private property, like your purses or wallets or keys, locked up, because those are what go missing most commonly. So at St. Elizabeth, we have an ethics committee. Any patient, family member, physician, or associate can contact the ethics committee to ask questions or seek a consult about ethical questions that do arise in the care of a patient, and to seek help to deal with a conflict between families or patients regarding the care of or treatment decisions. And they are most commonly called upon when there's confusion or disagreement about how to proceed with a difficult clinical situation, or conflicts often or are more common to arise in end-of-life care and mother-baby complications, all difficult situations. So the ethics committee is there to listen to patients, the families, physicians, everybody involved, the clinical people, and help identify the conflicts, all of the bioethical issues that are involved, and support everybody through a process to talk through those and resolve. These are always complicated, stressful patient care situations. What they do not do is they do not make the decision. That is a common misconception. The final decisions, if possible, are made by the patient. If not the patient, then the family and the healthcare team. St. Elizabeth Healthcare follows the United States Conference of Catholic Bishops' Ethical and Religious Directives for Catholic Healthcare Services. A copy of these directives can be found on that website, or certainly ask us in the office. Diversity. Going back to that, our core value of respect. Respect is the foundation of a culture of diversity and inclusion. Learning about those who are different from us is an ongoing process. It's impossible to know everything about every culture, every individual. But respect is the tool that works even when we don't know what to do. Respectful curiosity and openness to learn are powerful, and they're always appropriate. So when you don't know what to say, you can always try this approach. I really want to assist you, or I really want to know more. Can you help me understand what it is you need? Can you please tell me more about that? If you feel you have inadvertently upset somebody, a respectful apology is always appropriate. I'm sorry I've offended you. I did not mean to. I really do want to do better. Can you help me with that? And then move the focus back to the individual, because it's about them, it's not about you. Unconscious biases are sometimes called implicit biases, and we all have them. Being able to quickly categorize people and react are important to our survival as a species. We've all had to develop that. But we also can work to become aware of what our unconscious biases are, and then we can consciously decide not to act on them. We can consciously decide to get to know this person as an individual and not as part of our unconscious bias. And we have a multicultural environment here at St. Elizabeth. There's so many different cultures operating simultaneously, which increases the chance of a misunderstanding the more we interact with each other. Today, 1 in 4 Americans is a member of a racial or ethnic minority group, and by 2070, 1 in 2 will be. And for the first time, we have more people older than people under the age of 16. So we're very diverse. And one of the ways that we differ is in language and communication styles. The inability to communicate easily will increase the level of frustration for the speaker and the listener. We all know that. An important factor affecting communication is our awareness of people who have limited English proficiency. The same law that directs us to provide an interpreter to the deaf also directs us to do so for people with limited English proficiency. And St. Elizabeth has telephone interpreters, live video interpreters, in-person interpreters. We can do translations for documents and sign language. So just be aware we have all that, and the staff in your department should have that information. Another frequent bias in healthcare is size and shape differences. In 2016, all states reported that greater than 20% of adults in their states were obese. In Kentucky, it was 30 to 35% of adults reported that they were obese. Obesity is a complex chronic disease. It's not just somebody who overeats. It has many, many causes: genetics, hormones, environment, psychological, illness and medication, socioeconomic status and culture. All of those things can contribute and do contribute to somebody having the chronic disease of obesity. There is weight bias in healthcare. Nearly 95% of those individuals with the disease of obesity feel like they've been discriminated against in healthcare. So, in examining some of our own biases, ask ourselves, am I comfortable with people of all shapes and sizes? Am I sensitive to concerns of obese individuals? How might I feel if I was in the hospital and the gown was too small, it didn't close? Or I overheard somebody say, hey, I need the big wheelchair over here. Or are you worried that the chair in the hospital waiting room might not hold you? Those are legitimate concerns. Healthcare programs that receive federal assistance are prohibited from discriminating on the basis of race, color, national origin, sex, age, or disability. Not only is it required, but it's, of course, the right thing. The diversity and inclusion goal at St. Elizabeth Healthcare is to create an atmosphere where we all come together in respect and strive to understand and value all differences. So it's time to get out that review sheet. Please make sure to print your name on the top. You will not use all the lines on there, your answer sheet. You'll just use 21 of them. Do know that you can pause at any time during this review sheet. So, number 1, I know that I am the patient experience. Please put down A if it's true and B if it's false. Number 2, AIDED is a communication tool that stands for. Number 3, I understand that we have a dress code and I am expected to wear my volunteer ID badge on my upper body whenever I am volunteering. Number 4, if you are hospitalized off for a medical reason or under medical care for an illness or condition that impacts your health or safety, even for a short time, you are required to have your physician complete a return to volunteer form. Number 5, I'm aware of St. Elizabeth's tobacco-free policy and I abide by it. Number 6, the Joint Commission holds volunteers to the same standards as associates. Number 7, St. Elizabeth is committed to being ethical in every way. If you think something isn't right, we want you to communicate your concerns. Number 8, if you have a concern to report, you may contact. Number 9, the toll-free report line is open 24 hours a day, 7 days a week, and is totally confidential for the caller. Number 10, which of the following is an example of workplace violence? Number 11, if you are a victim of workplace violence, you need to immediately report it to your supervisor and volunteer services, or if necessary, security. Number 12, St. Elizabeth has a zero tolerance for all forms of aggressive behavior. Number 13, you should always wash your hands with soap and water after using the bathroom. Number 14, which of the following is a symptom of stroke? Number 15, if you believe someone is having a stroke outside of St. Elizabeth Hospital or a St. Elizabeth Hospital, you should call 911. If you observe anyone with the signs or symptoms of a heart attack outside a St. Elizabeth Hospital, you should call 911. Number 17, the Ethics Committee makes decisions for the patient, family, and healthcare team. Number 18, the St. Elizabeth Ethics Committee is guided by the ethical and religious directives for Catholic healthcare services. Number 19, we are required by law to provide an interpreter to patients with limited English proficiency and to those who are deaf. Number 20, studies have documented weight bias in healthcare against patients that suffer from the disease of obesity. Number 21, the diversity and inclusion goal at St. Elizabeth Healthcare is to create an atmosphere where we all come together and respect and strive to understand and value all differences. So, thank you. You have now completed your 2020 annual training. Woohoo! So we will ask you to make sure that you bring that answer sheet to your volunteer services office, and we can record your compliance as well as your time. So looking forward to seeing you. Thank you so much.